Hello, this is Ethan Tiong, and this is my doctor diagnosis case study, and I'm doing it on patient 12. So I'm going to start with the patient's medical history. The patient is a 63-year-old male who has been treated for 2 myocardial infarctions, hypertension, type 2 diabetes, and stasis dermatitis of the left leg. He has also had an aortocoronary bypass 1 year ago. So his current symptoms. He has a shortness of breath, which has been progressive over the past 5 days. He has, however, experienced episodes of shortness of breath during the past 4 months, especially when exerting himself. He fatigues easily and complains of wheezing when he exerts himself. His breathing is labored and his lips have a blue tinge. There is an irregular pulse. There is also a pitting edema of both lower extremities. He describes waking up in the middle of the night gasping for air and seems to be more comfortable sleeping in a chair instead of a flat surface like his bed. So based on this information, my diagnosis is that patient 16 has heart failure. Very unfortunate. Heart failure is a condition that develops when your heart doesn't pump enough blood for your body's needs. This can happen if your heart can't fill up with enough blood. It can also happen when your heart is too weak to pump properly. The term heart failure, however, does not mean that your heart has stopped. It just means that there is a serious condition that needs to be dealt with by a medical professional. So the reasoning for why I have diagnosed this person with heart failure is the symptoms and medical history line up quite well. So he describes a pitting edema of both lower extremities, which means that there are swelling in his legs, hands, or feet. He describes shortness of breath, low blood flow, and I got low blood flow from blue lips because that means that his lips are being oxygen deprived, which is why they turned blue because of the lack of oxygen. And this can result from low blood flow. And his irregular pulse indicates that there may be something odd going on with his heart. His medical history further supports this guess because he's 63 years old, and usually people who are 65 and above start to have heart failures and it becomes more common, and 63-year-olds is pretty close to this threshold. And he's also had a history of heart issues, given by example from his aortocoronary bypass a year ago, a myocardial infarction, and there also indicates to be another heart issue due to hypertension. It means that his heart either has been working overtime or something else may be at play due to the higher blood pressure. So to further confirm this hypothesis, I would recommend 4 different types of testing options. There is the blood test, which is 94% accurate, so it is right a lot of the time and is generally a very good option. This would be my number 1 recommendation. Next, for x-rays, they vary quite a bit in results. A trained radiology expert diagnoses it up to 85% of the time, maybe even a little higher, whereas new first-year medical students don't really even achieve 79% accuracy. So it depends on who is diagnosing you, because there's quite a bit of skill when reading an x-ray. Now for an EKG, ECG machine, it's only right 33% of the time because these machines aren't designed to diagnose heart failures. They just show the heart rhythm and does not give enough information really to draw a accurate diagnosis. Now, a stress test, which is most often seen, like running on a treadmill with diodes hooked up, is an okay option, is right about 69% of the time, but there are better options, such as an ink through the veins that allow doctors to see the flow of blood and a catheter to draw it back out. So there are better options, but usually a combination of these testing options are used to give the best and most accurate diagnosis possible. Now, here are the treatments for a heart failure. The first are ACE inhibitors, or their long form, angiotensin converting enzymes, and they are inhibitors. These drugs relax blood vessels to lower blood pressure and improve blood flow to decrease the strain on the heart. And if you are allergic or have some kind of reaction to ACE inhibitors, there is a secondary option called ARBs, or angiotensin 2 receptor blockers. They basically do the same thing as ACE inhibitors, just as an alternative in case you have complications with the first one. Now, the second option are beta blockers. The medicine slows down the heart rate and lowers the blood pressure. It reduces the symptoms of heart failure and helps the heart work better by reducing the workload. And also, if you have heart failure, it can also extend your lifetime by a little bit, just by helping your heart have an easier time functioning. And last but not least, it would be diuretics. And diuretics are often called water pills, and they help you urinate more frequently. This helps prevent fluid buildup in your body, and this is quite important as fluid buildup becomes a long-term issue of heart failure. So diuretics are quite important, especially for our patient who seems to have swelling in his lower areas. So perhaps the diuretics will be able to flush out the fluid buildup in the swelling areas. So what are the effects of heart failure on a patient? So even assuming that you make a complete recovery, kidney damage and liver damage are quite commonly seen because the blood flow is reduced and it becomes congested in veins, and this will lead to blockages or in some cases pressure buildup in the veins, causing pressure and organs to swell, which will damage them. And this will also have a long-lasting lifestyle change on the patient. They may not be able to do as much as they want anymore, and they have to take medication almost daily to make sure that they're healthy, and they need to watch what they eat, monitoring sodium intake, and making sure they drink lots of water. And finally, mental health is also at an increased risk for heart failure patients. Depression and anxiety become more likely to happen, so they need to make sure that they are socially healthy and they are watching out for their feelings. So thank you so much. I hope you are excited as this fish from this presentation, and thank you very much. Here are the resources I used, and if you'll excuse me, I'm going to have a heart failure of my own. I am absolutely starving.